अस्सलाम वालेकुम, I'm सोनिया रहमान कुरैशी और आप देख रहे हैं द फर्स्ट ब्लास्ट। और आप ये भी सोच रहे होंगे कि मैं अचानक उर्दू में क्यों बोल रही हूँ। हमें आपसे बहुत ईमेल्स आए, बहुत ख़त आए, बहुत एसएमएसेस आए और बहुत से लोगों ने ये बात हमसे की है कि हमें बहुत शौक़ है आपका प्रोग्राम देखने का, लेकिन बहुत दफ़ा हमारी समझ में नहीं आता कि आप एग्जैक्टली क्या बात कर रहे हैं। दैट इज़ वाई वी हैव डिसाइडेड कि हम थोड़ा बहुत उर्दू को भी शामिल करेंगे अपने प्रोग्राम में। आज का प्रोग्राम बहुत ही अच्छा है, पेन मैनेजमेंट पर है। और पेन मैनेजमेंट का मतलब ये है कि तकलीफ़ को किस तरह बर्दाश्त किया जाए या किस तरह संभाला जाए। तो बहुत से ऐसे पेशेंट्स आते हैं और आपकी फैमिली में भी, मेरी फैमिली में भी, हम सब की फैमिलीज़ में ऐसे लोग होते हैं जो सालों आर्थराइटिस सफ़र कर रहे हैं। उनके घुटनों में दर्द होता है, किसी की हिप टूट जाती है, बुज़ुर्गों की तो हिप रिप्लेसमेंट होती है, उसके बाद तकलीफ़ होती है। बेसिकली आपकी ज़िंदगी नॉर्मल नहीं हो पाती तकलीफ़ की वजह से। यू कैन नॉट रिटर्न टू अ नॉर्मल, हेल्दी, unconscious sort of relaxed life in which you are not constantly nagged about the pain that you are suffering. The whole point is you don't need to do that anymore. There is medication, and pain itself is actually treated as a disease in itself. With that, let's go and have a look at the sneak peek. Please don't go too far. और आप जानते हैं आपको वापस स्टूडियो ही आना है, तो आपका इंतज़ार हम कर रहे हैं. Join us again in a couple of minutes.
This is the number one reason the patient goes to a doctor.
There is a general, lack of understanding about pain and pain management.
Long-term pain is now considered a disease.
और अवेयर होना चाहिए एक पेशेंट को कि भाई अगर आपको तकलीफ है, किस हद तक तकलीफ है।
काफ़ी सालों से, मुझे तकरीबन 8-10 साल से।
8-10 साल
और 2 साल से बहुत ही बढ़ गई थी।
The quality of life is completely lost.
वो जो पूरी डोज मैंने कंप्लीट की है, तो नो मेरे को जो है ना अब कोई ऐसा मतलब अभी कोई प्रॉब्लम नहीं है।
और आपको कितने महीने पहले हो गए?
मेरे को ये बेसिकली इस प्रोसीजर करा के 6 मंथ हो गए हैं।
There is no need for you to suffer pain. There is no need. We can help you have a better life.
वेलकम बैक फ्रॉम द ब्रेक. थैंक यू सो मच फॉर स्टेइंग ऑन द शो विद अस टुडे. एज यू नो, आज हम बात कर रहे हैं पेन मैनेजमेंट पे, एंड काफ़ी मुश्किल सब्जेक्ट है और काफ़ी मुश्किल मौजू है एक्चुअली. वी हैव अ स्पेशलिस्ट इन द स्टूडियो विद अस टुडे, डॉक्टर आगा सज्जाद. Assalamu alaikum, Dr. Sajjad.
How are you?
Very well, thank you so much for taking the time out to talk to us.
Thank you very much for inviting me.
Oh, you're more than welcome, and thank you for taking the time out. And you are a USA board certified pain management specialist. You were also top doctor in state of Delaware for 3 consecutive years. I thought I'd just add that in. Dr. Sajjad, first and foremost, there is a general lack of understanding about pain and pain management. तो आपकी ज़रूरत कहाँ पड़ती है और किस किस्म के पेशेंट से आपका राब्ता ज़्यादा होता है?
Actually, let me tell you a little bit about pain. Pain क्या है?
Absolutely, है क्या exactly?
This is the number one reason the patient goes to a doctor.
Yeah, that's true.
Right? Most over-the-counter medicines are pain medicines. Pain बहुत diverse है, बहुत ज़्यादा है. It's better to divide pain in 2 categories.
Okay.
Usse it will be easier for people to understand how to diagnose and how to treat it. The first is acute pain, short-term pain. The other is chronic pain or long-term pain.
Long-term.
Short-term pain is usually a signal.
Okay.
Like heart attack, after surgery, labor pain. It's a signal. It has a couple of advantages and a lot of disadvantages.
Okay.
The chronic pain has been qualified. The long-term pain is now considered a disease.
Okay.
Right?
Okay.
So short-term pain, the advantages are that it helps us in diagnosis.
सही.
If
कहाँ दर्द हुआ तो पता चल गया कि बॉडी की इस जगह पे
का हो रहा है, इसका हो रहा है, हार्ट अटैक हो रहा है. It helps us a lot. Secondly, it immobilizes that part. Patient won't move that part if they are having pain. तो उसको secure करता है.
सही.
Right? The chronic pain on itself ये होता है कि if the pain persists beyond 3 months, 6 months, the different categories, then the nervous tissue जो है that becomes abnormal. Nerve cells जो है वो abnormal signal फेंकते हैं और उसकी वजह से वो उससे इतने प्रॉब्लम्स होती हैं कि अब हम उसको क्रॉनिक पेन करते हैं.
सही.
एक्यूट पेन जो है, अगर उसको सही तरह से फौरन, राइट आफ्टर द डायग्नोसिस, यू डोंट ट्रीट इट, there's a chemical release in the body that causes increase in heart rate, blood pressure, increase oxygen consumption. आपका जो दिफाई जो immune system है, that gets suppressed, and there are a lot of it. So the ideal way is to diagnose and right away treat acute pain. How many times have you heard, but maybe you haven't looked at this angle, through this angle, that he was suffering for back pain for 3 days and then he had a heart attack? Because this increase in heart rate, blood pressure, and all those destructive changes, in patients who have decreased blood flow to their heart, they are more prone to heart attack, strokes, फालिज हो जाता है, कुछ और हो जाता है. A standard treatment of heart attack all over the world is, if somebody goes with the heart problems or anything to the emergency room, standard treatment kya hai? Give them oxygen, under the tongue medicine, nitroglycerin, and morphine. And morphine is the strongest painkiller. Kyun? Taaki uska destruction badhe nahi.
Sahi.
Pain is in United.
Pain actually बीमारी है.
Yeah, I mean it has destruction.
आप कह रहे हैं बढ़े नहीं.
Right.
Yeah, it's destructive.
It's very destructive. And all over the world, now they treat pain very assertively, very aggressively. Where I'm from, the pain is fifth vital sign. What is fifth vital sign? There are 4 vital signs: blood pressure, heart rate, respiration, temperature. If somebody goes to an emergency room, the nurse will check these 4, and God forbid, किसी का blood pressure बहुत high, or their temperature is very high, 104, 105, that's an emergency. We'll take them right in, start an IV, start giving them medicines, या cold sponges देंगे वो. The 5th vital sign is the category. If somebody goes to the emergency room and says, my back pain is 10/10, it's an emergency. You just take him to the emergency room, you treat their pain right away, because that has a lot of destructive changes. For example, somebody had a surgery done, right? And the post-surgical pain is 2 weeks, say for example. Now the pain is persisting on 3rd week and 4th week. What has happened that the spinal cord, there is changes in the nerve cells, which changes aa jate hain. And studies have been done, research has been done, that changes continue to make that person feel that they are in a lot of pain. If the person is in a lot of pain, they can't go to work, they lose their job. Small chores like picking up your kid can become excruciating painful. So it takes away the joy from the life. And they get divorces. I mean, talking about
it has long-term repercussions.
Oh yeah. I mean, people do lose the quality of life is completely lost. Give you a couple of examples. There's a pain syndrome called trigeminal neuralgia. Facial pain hota hai, very, very intense, very bad. People have committed suicide just because of pain. And 20-30 years ago, it has a lot of treatment options now, nerve blocks, this, that. 30 years ago, there was a very complicated surgery for trigeminal neuralgia. And it was a 50% mortality rate. 50% लोग मर, 2 में से 1 मर जाता था, 1 बच जाता था, right? People would agree and go for that surgery knowing that there's 1 in 2 chance that we will die. Right? Why assisted suicide is becoming more popular? If you take away person's, quality of life, if you you're having,
take away the dignity as well, in a way.
Right. So that's why it is classified, it is treated like a disease, like somebody would treat their blood pressure, somebody would treat their diabetes. We tend to treat the pain, the long-term pain, if it's compromising person's life, the same exact way like we would treat sugar, diabetes.
Absolutely.
So there are a lot of treatment options these days available. The first and foremost is that the people should be aware, they should know that they have pain for 2 years in their back or their neck or their head, they're getting migraine or something, that they should take it as a disease, treat it as a disease, and get a quality of life back. migraine, arthritis, back pain,